If you have diabetes, do you understand why it is so essential for you to keep it under control so you can avoid the complications that go along with this horrendous disease? Do you know what complications can occur with uncontrolled diabetes? In today's video, we will be going through some of the nasty effects of diabetes that you want to avoid at all costs. Good morning, health-minded people. I'm Dr. Snow, and I teach you to stay as healthy as possible to keep you on the fewest medications as necessary. Complications from diabetes are usually caused by damage to the small blood vessels of your body. If the damage occurs to the vessels of the retina in your eye, it is called diabetic retinopathy. The small vessels break, causing bleeding in the back of your eye, and this can lead to permanent decrease in eyesight or even blindness. When the blood vessels in your kidneys break, you can develop diabetic nephropathy or kidney disease. And if enough of the kidney tissue is damaged, you may end up on dialysis or need a kidney transplant. Neuropathy is the disease that may develop when the vessels are damaged near the nerve endings, causing nerve damage. Peripheral neuropathy is nerve damage in the feet and hands that may cause tingling, burning, pain, or numbness. If you can't feel your feet, you may not know when you have injured the bottom of your foot, and you can develop an infection. Because uncontrolled sugary blood doesn't circulate well, it can't remove the infected and dead tissue from the area, and it can't bring in nutrients and oxygen your body needs to heal the infection. Left untreated, a minor infection can quickly develop into a major infection and even into gangrene, which may lead to amputation. It is important to look at the bottoms of your feet every day to catch an infection early to prevent complications. Diabetic foot amputations usually start with one or two toes, but because the surgical wound is difficult to heal, it may progress to half a foot, then the whole foot, then just below the knee, and then higher. Use a mirror on the floor to check your feet or have someone else check them every day. This may prevent those extreme measures. If you're learning something from this video, please press that like button and consider subscribing to my channel. Nerve damage can also occur in your stomach that may lead to decreased ability to move food out of the stomach and on down the way. This is called gastroparesis or paralyzed stomach. If food can't move out of your stomach, it can cause extreme nausea and vomiting and loss of appetite. If the nerve damage occurs lower in the digestive tract, you may end up having diarrhea or constipation and may have difficulty voiding the bowels. Also, you may lose the ability to feel when your bowels need to be emptied, and this can lead to accidents. If your bladder is affected, you may develop urinary incontinence, increased urinary tract infections, and kidney stones. And you can lose the ability to know when your bladder is full. Diabetic neuropathy may also cause impotence or erectile dysfunction. If nerve damage occurs in your ear, you may have hearing loss to the point of complete deafness. If damage occurs in your heart, you can have a heart attack or develop congestive heart failure. A heart attack is the blockage of a heart vessel so that the blood supply that carries oxygen to the heart muscle is cut off, causing part of the muscle to die off. If the wrong area or too large of an area dies off, you may die off. A person with diabetes is 2.5 times more likely to develop congestive heart failure or CHF than a person without diabetes. Congestive heart failure occurs when your heart muscle is no longer strong enough to pump blood throughout your body. CHF can cause fatigue, weakness, shortness of breath, even when you are at rest. It can cause irregular heartbeat and swelling of your legs and feet, which is called edema. If diabetes damages the vessels in your brain, it may kill off a part of your brain. This is called a stroke. Depending on the area the stroke occurs in, it may leave you with very little damage, or it may kill you. Unfortunately, damage in between these two extremes may leave you unable to speak, unable to walk, and unable to care for yourself. Strokes are a very bad complication of diabetes. Diabetes has also been associated with Alzheimer's disease and vascular dementia. Vascular dementia from the lack of blood supply to the brain due to insulin resistance can impair memory, language, and other thought processes. This list of complications that may occur shows that death isn't the worst thing that can happen to a person who has diabetes. If you would like to learn about the symptoms that may mean you are developing diabetes, watch this video next. Thank you for joining me today to learn why it is so important for you to get your diabetes under control to avoid these complications. Stay healthy, check your feet, and have a blessed week.